Hi, my name is Beth Seidel, and I'm an international board-certified lactation consultant at UnityPoint Health Methodist in Peoria, Illinois. I've been a lactation consultant for 23 years. With many parents choosing to leave the hospital early after the birth of their baby, often as soon as 24 hours after birth, there's a limited amount of time to accomplish many things. With hearing screens, mom and baby assessments, completing the birth certificate, having a circumcision, there's not much time for parents to rest and work on breastfeeding. There are some things, though, that you can do to help your baby feed better. Spend a lot of time skin to skin with your baby. Undress your baby down to a diaper, place him inside your gown or shirt against your bare skin. Skin to skin helps to stimulate the milk supply. It also helps to interest baby in feeding. If after 30 to 60 minutes, baby hasn't woken to feed, go ahead and take baby out of skin to skin. Being removed from that warm, snuggly place can help to wake baby enough to be interested in feeding. Room in with your baby if possible. Rooming in means keeping your baby in the hospital room with you throughout your whole stay. Babies who room in feed more frequently, and parents are more likely to respond quickly to feeding cues. Babies who room in tend to lose less weight, and they're less likely to be jaundiced. These things help to decrease your risk of a prolonged hospital stay or a readmission to the hospital. If you can't get your baby to feed at the breast in these early hours after baby's birth, use your hand to remove milk from your breast. This is called hand expression. With hand expression, you can use a spoon or a medicine cup to collect the small drops of milk that you might be able to collect. You can then feed this milk back to your baby off of the spoon, or you can have baby suck on your finger and place a little syringe in the corner of his mouth so he can get that milk that you worked hard to collect. Sometimes that little small appetizer of milk can wake baby up enough to be interested in feeding. When babies go home from the hospital before they're feeding well, we often see parents not meeting their breastfeeding goals. Another thing that we see is that they're readmitted to the hospital for poor feeding or high jaundice levels. I know it's hard to stay in the hospital when you want to go home, but just please keep in mind that another day and night in the hospital might be exactly what babies need. Sometimes all they need is a little extra time and a little extra help to get going really well with breastfeeding. Don't hesitate to ask for help. We want to help you meet your breastfeeding goals. We know that babies often wake up in the middle of the night, and that's when they really start feeding well. And it can be so helpful to spend that extra night in the hospital to get that help from the staff. If you do go home and you're still having problems with breastfeeding, reach out to your WIC office or call the lactation consultant at the hospital. We really want to help you meet your breastfeeding goals. That's what we're here for.